Now we're going to look into how to treat the neck patients. Neck patients that are several diagnoses there, but if you go into a program on the Skanlab, the car pulse, we have choices of diagnosis. Pinching the bubble pointing at the neck, we get like whiplash syndrome, torticollis, myalgia, or mobilization, pre-treatment for mobilization of the neck. I know several manual therapists and chiropractors using this like a pre-treatment for manipulation as well. My choice of treating the neck is very often do it when you sit. Then I have all the area for the neck reachable, depending on what I'm going to treat. If I have a kind of a torticollis problem, that the neck is twisted, I'm kind of located to get a detension in the muscles that is kind of on the high tension. If I have a whiplash patient, I sometimes would like to heat up the whole area. A lot of whiplash patients don't really afford and can't take massage or other kind of treatments because it's so painful and sore. Using the Skanlab, the car pulse, will get a decrease of the pain and also a smoother muscle system, which can be beneficial for the patient to be able to do some light exercise by training the deep core muscles, for example. Doing this treatment means that we have to use as always, a return electrode, and we always put some cream on the return electrode. While I have the patient sitting, I prefer to give this return electrode for the patients to handhold it. So if you please take this one in your hand with cream on, and then I put cream on the treatment head or the area I'm going to treat. For example, we have a very tense muscle on the left side of his neck, and he has a problem to twist his neck to that side. We try to pre-treat that area with the Skanlab treatment and the car pulse. We put lubrication on the treatment head or on the body. I prefer sometimes to put it on the treatment head, spread it out in the area I'm supposed to be treating, and then I choose the program, pre-treatment for mobilization, and I say OK, and then we get the pre-settings for that treatment. It's an 8 minutes treatment depending on the size of the area. Sometimes you can need to take both sides with you, then you have to double the time, but if you only do one side, it's okay, only like this. And you can hold, but if you're going to hold your hand on the patient, keep a firm contact with the other hand. Spreading the cream out in the area, then I pinch the on button, and now we're starting the treatment. Circles. If you work really fast, it's not feeling so comfortable for the patient, so firm contact and not too fast working with the hand. If you go very, very slow, you get more electric static field in the same spot compared to if you go quick. Means that you can stay a little bit longer on the higher level of the energy. You would like to get the patient to feel and heat. I always ask him, it's not too warm?
No.
No, that's good, sir. If the patient tells me it's becoming too warm, I pinch one step down and continue my treatment. I don't have to hold my hand on the patients, I can just relax with my hand as well, but I always feel that the patient feels comfortable having me in contact with him. Gives them some more confidence of the treatment as well. Again, I ask the patient, is not feeling too warm, everything is okay?
Yeah, it's okay.
Yeah. If this was a pre-treatment for mobilization or manipulation, it's not a question of having several times a week, it's maybe 1 or 2, 3 sessions. If it's a whiplash injury, I break the treatment and talk further on. If it's a whiplash injury, that's a question of treating the patient regular to decrease the pain level, make the patient feel comfortable, able to do some more exercise, some stabilizing training, some core muscle training, and try to make them able to move freer. Everybody knows working with whiplash patients, there are several different problems with these whiplash patients. Not one is similar to another actually. But so in those patients it can be a long-term treatment period, and it can be a question of working with them regular for sometimes even years to be able to kind of at least live as good as possible with that problem. A torticollis problem is another story. A torticollis problem is a problem where you have, if it's born with or gets in the childhood, a juvenile torticollis problem, that's another story than if you get it from acute something happening. And then it's a question of maybe 2 or 3 sessions or spread over 1 or 2 weeks, and it probably should be solved. And of course you do this, and next to that you start to stretch the muscles. A pre-warm muscle is much easier to stretch. You get better results from the stretching afterwards as well. And of course the pain relief is equally important, like the increased mobility in the system. After treatment, we of course get rid of the cream from the body and the treatment head, and also from his handhold electrode. We take it firmly off with some dry paper first. And sir, may I have your handhold, please?
Yeah, sure.
Thank you. And take this one as well. And I use some spiritus on this handhold part and the solid one to get it disinfected. And on the patient I use just the paper with water on to get rid of the rests of the moist on his skin. So just wet on some paper and take it off so we get rid of the rest of the cream. And that's also beneficial to do, because if you're gonna do some mobilization afterwards, if it's stuck some cream in the area, you might slip with your hands a lot as well. So it's very good to get rid of the lubrication really good before you go on further working with the patients with your hands. For some traction, for example, if there's a pain in the neck and some degenerated problems in the neck, then they can be really beneficial to do some traction on the neck afterwards as well. Doing that with a wetted paper, and I will finally take some dry paper just to get the area really dry and nice to be able to get a good grip on the neck when I'm going to work with it further on.